Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. So today I wanted to share the ugly side of hallucinations and delusions and invite you to join us for our upcoming webinar, Navigating Hallucinations and Delusions in Dementia, which will be available December 1st. We will talk more about this webinar in just a little, but you can also find more information on it at letsbamboo.com/events. Tickets are currently available to participate in this event, but ticket sales do end Saturday, November 30th. If you end up missing this event, at the end of this episode, I will share with you how you can still catch it in the future, okay? Now, it's important to know that people living with dementia are at a higher risk for experiencing both hallucinations and delusions. Each type of dementia holds its own varying level of risk, but many of you will have to deal with these challenging symptoms at some point along your journey, and I want you to be prepared. And honestly, if I can be frank, you need to be prepared. Situations surrounding hallucinations and delusions can quickly and easily grow from bad to worse, and I want to make sure that you are equipped with the right knowledge and tools to face these challenges so that you can reduce the risk of things taking a real ugly turn and improve both your partner's quality of life as well as preserve your own personal well-being, okay? So, what does it look like when managing hallucinations and delusions go wrong? So, first, let's just talk about how emotionally distressing hallucinations and delusions can become. If your partner is experiencing an emotionally distressing hallucination or delusion and you don't know how to best respond, it can heighten their fear, agitation, or paranoia, and even damage their sense of safety and trust in you, which obviously risks tainting the relationship. And as I always say, you want to avoid tainting the relationship because it can create some very challenging situations. Now, the reality is nobody likes feeling like they aren't being believed or taken seriously. Nobody likes feeling like their experience is being dismissed. Nobody likes feeling like someone could potentially harm them or take advantage of them. And as a caregiver, you may be doing all the things you think are right and that makes sense to do, but yet everything you do seems to be making the situation worse. Understandably, this can leave you feeling helpless, stressed, frustrated, and emotionally drained. Over time, often more quickly than expected, this can lead to caregiver burnout. You may begin to feel increasingly anxious, depressed, or notice the impact on your own physical health. And because your well-being matters, as it should, you might eventually face the difficult decision of placing your partner in a care facility. Now, while this may not be the worst option, it likely wasn't you or your partner's preferred choice, and it can leave you struggling with feelings of guilt, okay? In addition to this, we all know that people who aren't directly involved in the daily care of someone with dementia can be so quick to judge and question your caregiving decisions and how you handle difficult situations with your partner. This can create unnecessary tension in your relationships, with family or friends unfairly placing blame on you. Relationships are already complicated enough. Do we really need this added stress? I would say no. Another thing that could go wrong is unsafe behaviors that may result in injury to your partner or others, including you. For example, if your partner is trying to escape from or deal with a perceived threat or issue, they may end up engaging in risky behavior, falling, or injuring themselves in some other way, like burning themselves to get rid of bugs on their skin. If your partner feels like they need to defend themselves, or someone or something is the target of a delusional belief, it could result in a fear response or aggression towards you, others, children, or pets. And of course, with this, if the situation escalates, police may have to get involved, And then that can just lead to further issues and even legal complications. So, if at all possible, we want to learn how to handle these type of situations and know how to de-escalate the issue so that we can avoid these kind of tragic outcomes. Another big thing that could go wrong is the overlooking of medical causes. It is super easy to assume that hallucinations and delusions are just a part of dementia, but sometimes these symptoms are triggered by underlying medical conditions, including medication side effects. However, if you aren't aware of this, you may not follow up with the doctor in a timely manner or know how to advocate for your partner by encouraging the doctor to rule out medical causes for your partner, especially if these symptoms appear suddenly or appear to worsen. And then lastly, I just want to mention that another thing that can happen is over medication of your partner with dementia, an attempt to manage the hallucinations and delusions. Unfortunately, medications are often seen as a quick fix. But the problem is they fail to address underlying triggers of the behavior. Now, is there a time and place for medications? Yes, they definitely can play a very important role, but they are often prescribed without a thorough holistic evaluation of the situation and can have some very severe consequences when not properly prescribed and then monitored, okay? Now, of course, there are definitely more things that can go wrong when you're unprepared for or just simply unaware of how to best deal with hallucinations and delusions, but I don't want this episode to be all doom and gloom because there are ways to avoid many of these situations, and help is available. So, one of the best ways to prepare is by joining our webinar. We're offering an on-demand webinar called Navigating Hallucinations and Delusions in Dementia. It will be available for viewing from December 1st to December 7th. During this webinar, you will learn the differences between hallucinations and delusions in dementia, the factors that influence these symptoms and how they affect both your partner and you, the most common types of hallucinations and delusions caregivers encounter, the role of medications, including antipsychotics, and the risks involved with their use, and then practical non-pharmacological strategies to help you manage and respond to these symptoms effectively. All of our webinars are interactive, so I'm not just talking at you. I try my best to involve you in the learning experience through poll and survey questions. I also include real-life case study examples. Plus, I provide additional printables that will be available for you to download so that you can carry over what you learn into your caregiving journey. As a part of this webinar experience, we will also be hosting an optional live Q&A session on December 6th at 5 p.m. CST. So if you have questions, I strongly encourage you to attend the live Q&A session. Now, if you can't make the session live, that is perfectly fine. We will provide you with several ways to submit your questions so that I can answer them in the form of a recorded video. Your questions are important to me, and so I make a point to answer every single question I am asked, okay? So if you want to be prepared and learn how to navigate hallucinations and delusions effectively, if you want to make what can already be a challenging dementia caregiving journey a little easier, I encourage you to join us for our webinar so that you can save yourself and even your partner a lot of unnecessary stress. If you would like to grab your ticket, please visit letsbamboo.com/events. You will see 2 ticket options. Please feel free to pick the option that best meets your needs. Now, if you missed this event, you can always join us inside the treehouse at letsbamboo.com/treehouse. All of our webinar replays are available inside the treehouse. We never want you to miss something important just because you discovered us at a later point in time, okay? But with that being said, I hope to see some of you join us. In the meantime, if you have any questions, comments, or future podcast requests, you can send us an email at podcast@whatthedementia.com or contact us through letsbamboo.com. If you are on Spotify or YouTube, you can always leave us a comment. Thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.